I'm Pamela Bart, and I'm a Southeastern Ontario Regional Stroke Clinical Nurse Specialist Nurse Practitioner. Today I will be discussing anatomy, signs, and symptoms of stroke. During this presentation, the following will be addressed: definition of stroke and TIA, functioning of the brain, factors that determine stroke severity, recovery from stroke, effects of stroke, recognizing and reacting to signs and symptoms of stroke, stroke risk factors including lifestyle and health conditions. Now we will look at the anatomy of stroke. The first point I want to make is that stroke is a brain attack. More specifically, stroke is a sudden injury to a part of the brain caused by an interruption in its blood supply. A stroke occurs when a blood vessel bringing oxygen and nutrients to a part of the brain either becomes clogged, and that's what's called ischemic stroke, or if the blood vessel bursts, and that's called hemorrhagic stroke. This picture shows a blood vessel that has become clogged by a clot, and the area of brain that has been supplied with blood by that blood vessel is dying. This is an image showing an ischemic stroke on the right side of the brain, and observe the swelling in the brain representing dead and dying tissue. There is a shift of the midline towards the left. The following is another radiographic image showing an ischemic stroke, and this time it's on the left hemisphere that you can observe the dead and dying brain tissue. This is a picture of a hemorrhagic stroke, and you can see there is a blood vessel that has burst and there is an area of bleeding in the hemisphere. This is a radiographic image showing a hemorrhagic stroke on the right side of the brain. A TIA, or transient ischemic attack, is a mini stroke caused by a temporarily blocked blood vessel. Symptoms usually last only a few minutes, and a TIA can be an important warning sign that a person may have a stroke in the future. TIAs come before strokes in some cases, and TIAs should never be ignored. We're going to talk about brain function. Essentially, the brain functions like a computer center, controlling our personality, emotions, behavior, movement and coordination, sensation, touch, temperature, pain, and perception of movement or position. It controls our vision, our perception, our ability to accurately interpret what we see. The brain controls our memory, our problem solving and reasoning, and our communication, speaking and understanding, and swallowing. Let's talk about brain anatomy. Essentially, the brain is divided into two hemispheres, a left and a right. The cerebral cortex is the outer layer of the brain, and it's responsible for many complex functions such as moving, feeling, thinking, speech, vision, and other complex tasks. Subcortical structures, deeper down in the brain, control many functions that are outside of our conscious control. For example, temperature regulation. The brainstem and cerebellum control a lot of vital functions in coordination. For example, breathing. Factors that determine the effect of a stroke include the location of the stroke. Some locations cause more effects than others, or more symptoms. The severity of the stroke, or the damage to the brain, and how well the body repairs the blood supply to the brain. Also, how quickly other areas of the brain tissue take over the work of the damaged cells. The recovery after a stroke is most rapid during the first 3 to 4 months following a stroke. However, the recovery may continue over many months or years. The recovery process is affected by the survivor's age and general health, the survivor's personality, the survivor's coping abilities and emotional state, and the support of family, loved ones, and healthcare providers such as yourselves. The effects of a stroke can be long-lasting and vary widely. Approximately 50% of people who have had a stroke will have some degree of long-term disability. Let's look at two big stroke risks, TIA and a previous stroke. The risk of stroke for individuals with TIA is 5% in 48 hours, 8% within 1 month, and 12% within 1 year. Therefore, if you've had a resident who has had a TIA, they have a 5% chance of developing a full-blown stroke within 48 hours. Therefore, it's important that if you have a resident who's had a TIA or is at risk for stroke, you consider implementing appropriate stroke prevention strategies. Approximately 25% of stroke survivors experience a recurrent stroke within 5 years. The stroke risk factors that fall under the category of lifestyle include cigarette smoking, sedentary lifestyle, alcohol abuse, unhealthy diet, and obesity. And stroke risk factors that fall under the category of medical conditions include high blood pressure, diabetes, high cholesterol, heart failure, heart disease or valvular disease, atrial fibrillation, carotid artery stenosis, a positive family history of stroke, coagulation disorders, and psychological factors such as depression and anxiety. So you may ask yourself, why do I need to know the signs and symptoms of stroke? Well, I need to know them because they will increase my understanding of the problems experienced by residents who've had a stroke. Knowing signs and symptoms of stroke will also enable me to take actions to help residents who've had a stroke. And also it will help me to improve care for residents who've had a stroke.
If someone were having a stroke right now, would you be able to recognize it? Do you know the warning signs and symptoms of stroke? Did you know that the symptoms of a stroke may vary depending on where in the brain the stroke occurs? What would you do if someone were having a stroke right now? How would you react? Your ability to quickly react to the signs and symptoms of stroke is very important. You may be able to help that person avoid a stroke or lessen the severity of his or her stroke. The signs and symptoms that a person may have as a result of a stroke depend on where in the brain the damage has occurred because of the stroke. It is very important for you to be able to recognize the signs and symptoms of a stroke, note or record the time the signs of a stroke began. If the onset of the symptoms are not witnessed, then it is important to determine when the person was last seen well. And finally, you must get immediate medical attention by dialing 911. Your quick action could help avoid a stroke or reduce the severity of the stroke. Otherwise, these symptoms may remain and become permanent for that person.
The sudden appearance of any of these symptoms can mean that you are having a stroke. Get immediate medical attention. Call 911 or your local emergency number. A message from the Heart and Stroke Foundation, supported by the Government of Ontario.
The following are warning signs of stroke. Warning signs occur suddenly and may include sudden weakness, numbness, and or tingling in the face, arm, or leg, usually on only one side of the body. Sudden loss of speech or trouble understanding speech. Sudden loss of vision, particularly in one eye or double vision. Sudden, severe, and unusual headache or change in the pattern of headaches. Sudden loss of balance, dizziness, unsteadiness, or sudden falls, especially with any of the above signs. Let's view 3 different vignettes. Each vignette portrays a person who is having or has had a stroke in a different part of the brain. You will be able to see that people are affected differently depending on where in the brain the stroke occurs. Stroke is an emergency situation that needs immediate medical attention. The following vignettes will help you to recognize the warning signs of stroke. The first vignette is an example of warning signs of stroke in the left hemisphere or the left side of the brain. While you're watching this vignette, See if you can identify the warning signs of stroke that Fred is having.
Hiya, Fred. How you doing?
Oh, I'm fine. You know, I can run just as fast as ever, but I just can't go as far.
You just never change, do you? Yeah. I see you had turkey dinner. Did
Oh,
you have
yes.
stuffing with that too?
Oh, yes, I'm really stuffed.
Yeah?
And you know what? We had stuffing with our turkey.
Fred, you never change.
But you know what? I was wondering,
What?
how long can you keep a turkey in a freezer?
6 months.
Really?
Oh, yeah.
Well, that's strange. I put it in the freezer last night, and the darn thing was dead this morning.
Oh, Fred, you got me again. Fred, what's wrong? What's wrong? What's wrong? Somebody help! Help! What's wrong?
Fred, Fred, what's wrong? Fred, can you move your right arm? Can you move your right leg? Fred, can you close your eyes for me, Fred? Can you point to the ceiling?
In this video clip, were you able to identify any of the warning signs of stroke? Weakness, numbness, and/or tingling in the right face, arm, and leg. The right side of Fred's face suddenly became weak and drooped. His right arm suddenly fell limp by the side of his chair. Fred's right leg has flopped to the side. He suddenly started to slouch over to the right side. Did you notice how Fred grabbed his right arm with his left hand, holding it as if he couldn't feel it? It seemed that he had tingling or diminished feeling of his right arm. Fred suddenly experienced loss of vision in his right visual field. His gaze was deviated to the left side or his strong side. He was unable to move his eyes to the right. Fred was suddenly unable to speak and had trouble understanding speech. He lifted his left hand and started to speak, trying desperately to communicate something to the cafeteria worker, but could only utter incomprehensible slurred sounds. He's unable to clearly say any words. In this vignette, the cafeteria worker sees Fred just prior to his stroke. Then moments later, the cafeteria worker returns to see Fred showing clear signs of a full-blown stroke. She calls for help immediately. She should also note the time she last saw Fred well. This is when she was taking his tray away. The cafeteria worker's quick recognition of Fred's stroke symptoms and quick call for medical help will help to avoid the stroke or reduce the severity of the stroke. The second vignette is an example of a right hemisphere stroke or a stroke to the right side of the brain. While you watch this vignette, try to identify the symptoms of stroke that Mrs. Cooper has.
Ooh, they smell good if I say so myself. Sarah, honey, it's Mom. Yes, are you still coming? The cookies are fresh out of the oven. I've got a favorite storybook. Okay. You're on your way. Okay. 15 minutes. Don't be late. All right. Take care. Oh, got her favorite book. Oh, you darling. Mrs. Cooper, Evelyn, it's Sue. How are you?
Sue, I'm just fine.
Well, I heard
heard you had a bad stroke. How are you feeling?
Oh, Sue, no, it was just a tiny one. I expect. Look, I'm moving everything around just fine. If I keep going like this, I'll be home by the weekend.
Well, I heard you'd had a big stroke, Evelyn. Evelyn, what can I do to help? Can I move your arm up here on the pillow? It looks very uncomfortable.
No, it's just fine.
Oh.
Just fine. Everything's moving just fine. It's on the pillow. I'm just fine. It's just a little stroke. Quit worrying so.
Evelyn.
While you're here, I want to show you a picture of my little granddaughter. It was years to men ago.
Well, it's right here, Evelyn. It's right here, Evelyn. You see? Over here on your left. Right here.
I can't see it.
Evelyn.
Where is this
Evelyn.
little picture gone?
Evelyn, why don't we have a small prayer, okay? Let's do that.
Okay.
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 Let's pray.
Okay.
Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. In this video clip, we first see Mrs. Cooper well, and in the second part of the clip, we see Mrs. Cooper in hospital as a result of having had a stroke. Were you able to identify the following symptoms of stroke? Let's review. In this clip, were you able to appreciate Mrs. Cooper's severe left-sided weakness in her face, arm, and leg? She was slouched over to the left side of the armchair. Her left foot was hanging off the edge of the footrest. Her speech was slurred due to weakness of her facial and oral muscles. She experienced loss of vision of her left visual field. Her eyes were deviated to the right side or her strong side, and she was not moving her eyes to the left, and therefore she couldn't see the picture of her grandchild on the left side. Mrs. Cooper showed lack of awareness of the left side of her body. She had her right hand up in the prayer position, believing she put both hands together. She was unaware that her left face, arm, and leg were paralyzed. Her left arm was hanging to the side of the chair. She was unaware of her left-sided weakness. In this vignette, we were unable to determine when Mrs. Cooper's stroke started. We see her well, and then we see her as a patient in the hospital. To have been able to help avoid the stroke or reduce its severity, someone would had to have been able to witness the onset of the stroke, or at least been able to note the last time Mrs. Cooper had been seen well. Then they would have had to have called 911 to get Mrs. Cooper to the hospital as soon as possible. This last vignette is an example of the warning signs of a posterior circulation stroke. While you're watching this vignette, see if you can identify the signs of stroke that Mr. Douglas is having.
Hello, Mr. Douglas.
Oh, hello, Johanna.
How are you today?
I'm fine, thank you.
Well, you look fine as ever.
Thank you.
They're ready for the sing-along in the common room, and I need some help getting some of the folks in there, and I think you're just the man for the job.
Wonderful. Well, let's get those old folks going.
Okay. You are my sunshine, my only sunshine. You make me happy when skies are gray. You'll never know, dear, how much I love you. Please don't take my sunshine away.
Oh, I don't know what's happening.
What's wrong? What's wrong?
Everything's blurry.
What's wrong? What's wrong?
Everything's blurry. I got a headache. I see through everything. I don't know what's happening. Oh, pain. I feel sick.
Oh, help! Help!
Let's review some of the signs and symptoms of stroke in this vignette. In this clip, did you notice that Mr. Douglas suddenly experienced blurry and double vision? He also experienced sudden dizziness, a sudden headache, and sudden nausea. Mr. Douglas became unsteady. He staggered, suddenly lost his balance, and fell. Mr. Douglas was showing warning signs of stroke. He was having a stroke. He needed medical attention immediately. In this vignette, Mr. Douglas' stroke onset is witnessed by his friend Joanna. Joanna should take note and report the time of onset to emergency staff. She should immediately call 911. Her ability to quickly recognize the signs and symptoms of stroke and immediately call 911 may help Mr. Douglas avoid this stroke or reduce the severity of stroke. In these vignettes, you saw examples of warning signs and symptoms of 3 strokes that occurred in different parts of the brain. Each stroke looked different depending on which part of the brain that stroke had occurred. In each presentation, you were able to witness the devastating effects stroke can have on an individual. It is important for you to know the warning signs and symptoms of stroke. If you notice somebody experiencing the warning signs of stroke, get medical attention immediately by dialing 911 and record the time the signs of stroke began or the time the person was last seen well. Your quick action could help avoid a stroke or reduce the severity of that person's stroke.